You're watching the Patriotic Channel, your go-to as far as political and current affairs stories are concerned. We are privileged to have an astute person here who is a household name as far as the media landscape as well as health-related issues are concerned in Ghana. We want to engage on a few topical issues that are happening. He is the immediate past CEO of the National Health Insurance Authority in the person of Dr. Dacosta Aboagye. Thank you very much for appearing on the Patriotic Channel. So we want to pick your thoughts on a few issues. One has got to do with the recent concern voiced out by the Ghana Registered Nurses and Midwives Association about the no birth syndrome. What exactly is happening in the space? Do you think it's getting better or worse?
Thank you so much. I think it's unfortunate that as a country, every year we have to go through the cycle of no birth syndrome. And it's also unfortunate to see patients dying just because they have no births. But you see, no birth syndrome is not just the births, it's a whole system. So the whole chain is actually broken.
Right.
And I think, a country which is digitally driven shouldn't be having such challenges, because we just need to put the system there. If you are bringing a patient and there are no spaces and there are no staff to look after the patient, it should be flagged on the system. Look, I worked in the UK NHS, in the emergency unit. I worked in various places. The fact of the matter is, you see, once a patient is referred to the hospital, it's locked on there. A place is allocated for the patient. So a broken referral system is what we are really talking about.
Okay.
And for this reason, we really need to fix it. It's a system problem. It's not, you see, look, why would you be sending a patient to a hospital that the person cannot be accommodated? So from emergency, that's from the ambulance service through to everything need to be fixed, and we need a coordinated effort. You see, I don't like politicization of our health system, because you see, look, as a country, if we are not careful, politics will divide us than it will unite us. The fact is, the people who need help, the patients, we have NDC patients, we have MPP patients, but when they go to hospitals, we do not ask them.
No political color.
No political colors. So we need to fix the broken system.
Right. So are you kind of suggesting that if indeed there is no bed in a particular facility, there should be a system to transfer the person to? Is there some form of collaboration between health
like
and
I
facilities?
said, in an AI digital age, why should we be having no bed syndrome? Right from it's just a call center. You just call from, the operative, okay, to a system. Okay, this patient has been referred to. Is there a space? No. Then you go to the next facility. So the patient is accommodated at where they will get space, where we can.
So we are not coordinated. There's no coordination. Everyone is working in isolation.
Everyone is working in isolation.
Is this something you started?
Well, you see, that's what you see. Look, I don't want to bring politics into this. Regardless, it is the NDC government that is there with technocrats. They can consult some of us. We need to fix the system. Like I said, it has no patients do not have political colors. If you are sick, will they ask you whether you are NDC or NPP? No. What are we looking for? We are looking for solutions. See, you come in and sack people, competent people, and just bring in. What do you expect?
People were sacked when there was change of government in the health sector.
We should separate political positions from technical positions. You get what I mean? It makes no sense. Unqualified people.
And why did they sack them? Why did they transfer them?
Well, in the name of politics, that you are MPP, you are NDC. This must stop. These things must stop. And I think we cannot continue to be doing this. These things must stop. You see, we are building a nation. We are not building individualism.
You're very passionate about this.
Yes, because you see, this shouldn't be Ghana's story. This shouldn't be Ghana's story. Ghana's story should be that, I'll give you a typical example about NHIS. You see, look, I left the NHIS in a very good footing. My predecessor, my the current CEO is continuing. Everything that I started, he has continued.
Right.
That is how we build a nation.
Right. Since you left, have you been consulted on anything?
Of course.
Okay.
I work with them. They called me. And so what? I'm MPP and so what? We are working for Ghana.
And do you think this happens in other agencies?
That's what I'm promoting. That's what I'm just saying, that it should happen. Because, see, we started preventive healthcare. They are continuing. Almost the primary healthcare. What is primary healthcare? Is it not the same CHIPS concepts that we started? They are continuing. So what I'm just saying is there must be continuity. See, the government must continue the Agenda 111, because during COVID, there were places that see, how do you feel if pregnant women are carried on bicycles to places? So the district hospitals are really important.
Agenda 111. I recently heard that Domahene making an appeal to the president to complete one in his area.
This was conceived through the COVID task force where Dr. Baumia.
So the project was actually gaining ground.
Yes. You see, I was at that meeting where Dr. Baumia actually proposed it. That no, we cannot have a system where people are traveling to regional hospitals. We need district hospitals. Just because it came from NPP, it's now, it's stuck.
So pay your assessment. Do you think it's been abandoned, most of these facilities?
Of course it is. See, what is the provision of Agenda 111 in the current budget? Why are we doing this to ourselves as a nation? And I'm appealing to the president. He should take this thing serious and let's move on as a country, because, see, Ghanaians trusted him with the mandate, a mandate to serve Ghanaians, not the mandate for a political party, a mandate for continuity in terms of development. Right. And I must say that, you see, look, he needs to continue with the project started. At the end of the day, the initial investments were what? Ghana money.
Right.
They were Ghana money, not any money from anywhere. They were from the scarce resources.
Right. That's great. Yeah. Thank you so much. Lastly, do you want to take thought on reparations and stranding?
I think that kudos to His Excellency the former President Nana Addo Dankwa Akufo-Addo for starting this, and kudos to John Mahama for continuing. I would believe that the crimes against humanity actually justice must prevail, and I believe that they are on the right course.
Right.
Thank you.
Sure. Thank you.